exam during finals week, you will be getting Unit 4 exam and the cumulative final together all at once. The Unit 4 exam will be the first few pages of your test, and it'll actually say Lecture Unit 4. Lecture Unit 4, you have a study guide for that. You have your homework packet. As usual, pay attention to your homework packet and your study guide. Lecture Unit 4 has the following systems on it: endocrine, integument, renal, digestive, reproductive, and embryogenesis. But that you already knew, right? That's not earth-shattering. I am still finessing the total number of questions for the lecture exam. You will have 2 hours during finals week, 2 hours. That's all you get for these exams. So the total questions for these exams you can expect to be no more than 120 questions. If you pace yourself to 1 question a minute, that's plenty of time. But when I am finished writing the exam, I will tell you exactly, because for some reason that puts you in your happy spot. I will tell you how many questions are on Lecture Unit 4 exam and how many questions are on the cumulative final. Please remember that the cumulative final is worth 5% of your overall course grade. It's enough where for some of you it could bring you down, so please pay attention to it. It's enough for some of you it could raise you up to the next level, so please pay attention to it. I do not take kindly to the students that have like 1,000% in the class and then give me 2 middle fingers up on the final exam. If you do that to me, don't ask for any favors when you try and get into other classes. Let's just put it that way. I don't like that. Give me your best up to the very end. For the final exam, I get often the question, how can I best prepare for it? The best way to prepare for it is to, 1, go through all of your previous homework packets. That's a very good start, a very good start. If there is a question in the homework packet that you do not remember the answer to, or I don't even remember studying this, you should probably go back to that PowerPoint and find that slide where the question came from. So start with your homework packet, review the questions. I recommend having a highlighter as you go through the packets and highlight questions where you're like, was I even there when Kara talked about this? It seems so long ago. Then go back to your PowerPoints and study that content. I think it's also a good idea to look at your book. Your book has some good end of the chapter questions. Not all of the questions at the end of the chapter are necessarily covering content that I covered. Some of them, let me say that again differently. Some questions at the end of the chapter might be from content that I said, we don't have enough time to worry about that. For example, embryogenesis. Every chapter had its own embryogenesis focus. We didn't do that. I saved it to the end. Nervous system, for example, the brain. There were a lot of association centers that I said you didn't need to worry about. There might be end of the chapter questions that asked you about those. If I didn't lecture on it, you don't need to worry about it. But I do think the end of the chapter questions are another way to review. When you get to the cumulative final part, it will actually say at the top of the page, cumulative final. All the questions that will now show up on the paper will be in order of your unit exams. So it'll say Unit 1. It'll remind you what systems we covered in Unit 1. It was body organization. It was cells. It was tissues, it was cartilage and bone, it was muscle and muscle contraction. So that will be all Unit 1. Again, look at your homework packet. That's just the best thing for me to tell you to do. When you're looking at Unit 1, I would review the language or the terminology, the language of the discipline. For example, what's an osteocyte versus an osteoblast? It's a chondroblast versus a chondrocyte. So make sure you review some of the key terms that you probably saw on some of the slides. Muscle, for example. What are your 4 F's? Filament, fibrils, fibers. Remember those F's? There is no essay. There is no essay. You might be saying, well, Kara, what about flowcharts? Well, do you remember your flowcharts from last unit where you had to put them in order and then you coded it in your Scantron? Be ready for that. My division does not give us a lot of time for turnaround for grades. The school policy says that I have to have them turned in by the end of the semester, which is actually quite a ways away. But my division says we want them in within 4 days. I have a lot of grading to do. So you can expect all Scantron, okay? But still, you can have flowcharts. Also in Unit 1, we learned about joints. Please review your functional and structural classification. That's a very good overview for joints. Unit 1, review your terms. What's sagittal? What's superior? What's inferior? What's proximal? What's distal? That was the language of our discipline for the whole semester. What are the levels of organization? Cell versus tissue versus organ system versus organism. I would review muscle contraction, just review the steps of it. We need to have excitation. We need to have excitation, contraction, coupling. We need to have contraction. For Unit 2, it was heart, blood vessels, lymphatic system, and respiratory system. You did take Lab Unit 3 not too long ago, so hopefully that's still pretty fresh in your head. I hope you know the difference between a vein versus an artery. Know the levels or progression from the aorta to a muscular artery, to an arterial, to a capillary, to a venule, to a vein, to vena cava, to have some food. Have some food. Review the chambers of the heart, the valves of the heart. I mean, anatomy is a prereq for phys, and if you do not remember the valves of the heart and the chambers of the heart, you're not going to do well in phys. Lymphatic vessels, remember they also have different, not criteria, but we have lymphatic capillaries, which will lead to lymphatic vessels. They converge and they get bigger. Then we get trunks and we get ducts. So look at their levels of going from very small to bigger. Let's see. Unit 3 was the nervous system plus special senses like eye and ear. Again, you just took your Lab Unit 3 exam. Hopefully you still remember the tunics of the eye. Hopefully you remember the different parts of the ear and endolymph versus perilymph, the bony structures versus the soft membranous structures inside. Endocrine system is on Unit 4, so please review your hormones. Pay attention again to your homework packet. Unit 3 also had peripheral nervous system and autonomic nervous system. Review your cranial nerves, meaning their numbers and their names, and roughly what they do, meaning are they sensory, are they motor, are they both? There were terms for Unit 3 as well. You should know what a nerve is, what a tract is, what a nucleus is, what a ganglion is. Those are all very, very important terms, and I need you to know them before, you can't forget them when you get into physiology. Please review your chart from Unit 3, that sympathetic versus parasympathetic chart. Where do you find the preganglionic neuron, the postganglionic neuron? What will they do to the heart, the lung, the eye? And I think that's enough. Good. Not so good. Almost done. Again, please pay attention to Canvas regarding next week, Tuesday's class.